Is Mildmay one of the most prominent AIDS organisations in Uganda?
Yeah, it's the most prominent. It is international. It is in UK, it is in Tanzania, it's Rwanda, Kenya, Nigeria, Ghana. I have a relative. He's HIV positive and he's on our program. But what happened to him when he got the ARVs for the first time? He developed some of these things I have read here.
Yeah.
So they told him to stop them for 2 months without taking anything.
Oh.
All the skin was full of rash and swell.
And how did they determine that that was the result of the drugs?
It was the results of the drugs.
And not the virus?
Not the virus.
Mm.
Standard dose or nevirapine. For 2 weeks, you cannot start this triomune.
Yeah.
I think that was the cause.
What was your cousin's condition while he wasn't taking ARVs for 2 months or any other medications?
Nothing. He was not feeling bad, but when he took those this kind of type of drug, it's what I suspect, because it is where the cause came from.
Yeah.
He started feeling funny, hypersensitivity, body reaction, skin rash. Immune, when it's taken without those combinations, it also can cause some of the body organs not to function well. That's what I can see.
Yeah. Yeah. And do you see those side effects occurring among patients at Mildmay?
It's common.
It's common. But do they die or?
Sometimes they don't. They don't. Anyway, I haven't little doubt that there are some who died because they have started ARVs. No? But I have a clear evidence. My cousin, the first week he started the art.
Yeah.
He developed those symptoms and signs I have read here.
You mean everybody who goes to Mildmay has to be medicated?
Once is in critical condition. This is why the kids are in critical condition. They come in critical conditions. And when they're in critical conditions, they don't start art immediately. They have to first do other things.
Give them food, supplements.
Then after like some time when the child has stabilized, they start what?
Would it be true to say that the overwhelming majority of these children that come into your care are malnourished when they arrive?
Yeah, they come. That's the commonest thing. They come when they are malnourished. So, and there's no how somebody can start art when it's malnourished, especially when it's a kid.
Is it understood that the CD4 count is low because of the conditions of poverty and malnourishment?
No, the CD4 goes down because the children have not yet started the art, and even the feeding is not well. The kid is not getting enough, a good diet.
Those two things seem to go hand in hand. Malnourishment and CD4 count.
Malnourished and a CD4 count and a viral load.
But the viral load test manufacturers state that the test not to be used as a screening test for HIV. This is the manufacturer's statement.
And even when you read the books, the scientists can tell you that the viral load test is not viral.
Yeah. Is this not compelling evidence from the manufacturers?
It's not intended
Yeah.
to be used as a screening test for HIV. That's one.
Is it recognized among those people doing the testing that there are 70 factors that cause positive results?
Yeah, even there's those cases where they are testing positive and yet somebody is negative.
So
It can test positive on determined and other kids
Yeah.
negative.
Are the people who are concerned with testing familiar with what the 70 factors that cause positive results are?
Yeah, some
like
of
TB
them.
and pregnancy and malaria.
Malaria, some of the treatments of anti-malaria, so many things, but sometimes they are ignored.
For the sake of what?
Once you see positive, once you see the strip is positive, yeah.
Then
Go on.
what happens to the children who arrive at Mildmay and they're presumed to be HIV negative?
The what? When the child is proved to be HIV negative, definitely she or he will be discharged out of the program.
And what will the outcome be for the child in question?
The question, the child they will be there with their parents suffering. Still, the organization cannot take care of somebody who is HIV negative.
And how often does this happen?
Several times, because when the child is malnourished, they will tell you that your child is not HIV positive.
Yeah.
So, what you do, you go to the hospital and treat malaria.
So they lose interest.
They don't have interest for HIV negative children.
Yeah.
Yes.
If the child who's presumed to be negative doesn't have parents, what
They can't take care of that one.
will they also be discharged?
That's the problem.
In Africa?
Yeah. They give out blankets and mattresses to HIV patients.
Mm-hmm.
HIV children only, and the mosquito nets.
Yeah.
If you are HIV negative, they cannot give you a mattress. They cannot give you. The donors bring those things: mattresses, mosquito nets, jerry cans, food, beans, whatever. Those things they are there, but they are specifically for HIV patients.
So
Even mattresses and mosquito nets, they are given only to HIV.
yeah.
If your child is negative, you don't have any access to get even a single seed of a bean. The 5 leading causes of death in children under 5 years in Uganda are malaria. Even 32% every year, it is low. It is low. Yes. It is very low. It is even 60%.
You think this should be 60?
60% below 5 years. Let me tell you a story. I was in Kawolo Hospital where I did my internship
Yeah.
after school. We used to get kids every day with malaria more than 100. That's the average. It's malaria. And 100, 40 will survive.
Yeah.
But the 60 will die. In an interval of a week, the child has malaria and she's malnourished. Understand?
Yeah.
This one should be 60. Let me tell you. HIV should be like 4%.
It should be 4%.
Even 3. HIV is the one which I think, let me say, that is the more funded. Even that organization you are seeing there, up there, you can use it there. You can come here and see.
What's it called?
JSRC.
Oh,
Yeah,
yeah.
most of you
Yeah,
can see
no.
the buildings are there. We are too much considering HIV to be a serious killer disease than any other thing like malaria. All of the organizations are concentrated in the last point.
For the patients considered to be HIV positive or have AIDS, And you're even suggesting that the 6% should be 3%.
Should be 3%. The children who are dying HIV should be 3%, not 6.
These children considered to be HIV positive or have AIDS, do they also present with these other diseases?
Yes, come on.
So
somebody with HIV coming with the 4 classes of malaria.
Is it true that those who are tested positive are looked after and given food?
Yes. And those who test negative and they have other diseases minus HIV, they will be
discharged.
You understand?
Yeah.
That's the thing. It's not a joke. That's the thing.